As of today, we have 3,230 cases, 45 deaths. We currently have no one in the hospital, 1,554 outpatient, so currently actively ill, but managing symptoms at home. Case fatality rate of 1.4%. Once again, quite a bit of monitoring going on relative to cases and close contacts, so those numbers are there. This is our daily curve for hospitalizations. We have basically, once again, kind of gotten ourselves down from a little peak in hospitalizations here. The increased transmission in the community does have us concerned about what might be happening in the next several weeks, but time will tell on that, because hospitalizations and death do tend to be a delayed indicator. So several weeks, 4 to 6 weeks after increased transmission in the community, typically we do see the increase in hospitalizations and increase in deaths. Currently, we are at 50.5% recovered, 48.1% currently ill, but at home, 1.4% deceased, and as you can see, we have nobody in the hospital right now. This is our cumulative curve. As you can tell, we clearly are not flattening out, although we're taking a little, maybe a little tip here back to that. And we'll talk about that in a minute. This is our incidence curve since the beginning of all of this. So this is March and April, when we were March, April, and May, when we were in, basically stay in place, stay at home order. This is the notorious outbreak that gets labeled as Harper's, but there were a few other things going on then. And here's what's going on right now. So when we look at the percent positivity, we also see that our percent positivity went up during the same period of time that our case counts, daily incidence counts, were going up. Our 7-day rolling averages can show you that not only are cases going up, but our percent positivity is going up as well. So this is not a matter of just more testing in the community. We have a significant upward trend in percent positivity. To be low in terms of risk, we need to be below 3, which we were up until about the 30th of August, somewhere in there, and we've been on an upward trend since. Please note that these numbers here that you're seeing that look like a downward trend, next time we look at this graph, could very well change, because as people get tested and then get the results back, and then we get in touch with them, we find out when their onset date was. And then that particular case, even though it might be reported, say tomorrow, may get added back to, this weekend, the 18th or 19th, when we find out that that was the onset of symptoms. So these things are always kind of a moving target when it goes to that, because we do have to attribute cases to onset date, if available, and referral date, if not. That generally means that somebody is asymptomatic, and so we don't have an onset of symptom date. So we use the referral date, or the date that they tested, in order to put them on a place on this graph. When we look at our cases by range, we are now at 1,261 to 1,270 cases in 48823, followed by 431 to 440 in 48911, and then down another half beyond that, 221 to 230 in 48910, and then you can see the rest of the numbers from there. Clearly now the cases by zip code, our darkest shaded zip code is 48823, followed by 48911 and 48910. When we look at that by rate, it really doesn't change anything a lot, just because of the magnitude of cases in East Lansing. They by rate are still the highest, with 48911 closely following, and whatever zip code this is, just above 48910 also by rate. So this is our heat map, which now looks very different. And I'm going to zoom in for you. As you know, we were tracking, kind of the zip code area over here in 48910. As the heat of this, the yellow gets more and more yellow, You know, it just can't get any yellower, you know, so basically the intensity of that now diminishes the look of the intensity in the other places that we were seeing. Those are still there. When there were, you know, less cases in 48823 and more in 48911, you saw that intensity differently. So the intensity of what's going on in 48823 right now is pretty much pushing the rest of the zip codes down into these lower kind of shaded areas. So that is why this looks very different from what you have seen before. We are 50% female, 50% male. Now by age group, we are 42% in the 20 to 29 age group, and we are growing rapidly in our 10 to 19 age group. I can tell you that I have dissected those a little bit, and I'm going to ask my team to do this for us so that we're not looking at, we need to put the, you know, 17, 18, 19-year-olds in a group, because truthfully, the cases in mostly 18 and 19-year-olds are the reasons for that now 20% in that age group. So below 18 is a very small number compared to the 18, 19-year-olds in that age group. We are 65% Caucasian, 15% Black or African American, 11% other, 6% Asian, 2% unknown. When we look at that by rate, we are now 985 with our Caucasian group, and then 1466 with our Black or African Americans, and 997 with our Asian. So our Asian population and our Caucasian population now looking about the same. And we are at about 1.5 times a rate in the African American population compared to the Caucasian population currently. 82.5% of those cases are not Hispanic or Latino, 8% Hispanic or Latino, 9.5% unknown. So that rate shows us at Hispanic or Latino at 1,109 and 992. This is just in a very, very tight range, which where you're seeing a very big gap in those numbers. You know, we started at 920 here and only went to 1120, so that kind of affects that. So, you know, there's still a difference here, but it is a bit more narrow difference. We have had a few additional deaths, including one in the 40 to 49 age group. So we currently have 2.2% of our deaths, 40 to 49. We are at 8.9% of our deaths, 50 to 59. 13.4% of our deaths, 60 to 69. 33.3%, 70 to 79, and 42.2% over the age of 80. Still in deaths as well, we are 50%, 50-50 male and female. When we look at that by race breakdown, 64.4% of our deaths are in Caucasians and 31.1% in African Americans, and 2.2% unknown and 2.2% other. When we look at the percent of deaths by ethnicity, 88.9% not Hispanic or Latino, 6.7% Hispanic or Latino, and 4.4% unknown. If we look at our current cumulative case graph in Ingham County, which I showed you earlier, and put a cumulative case graph of MSU cases in that, you can see that this upward trend basically parallels that. I mean, it's on a different scale, but if you put that up there, you can see that these cases are very much driving this trend that we're seeing right now. And that is not to say that there are other cases, but when you see this pitch of this graph and this pitch of this graph, they look very similar, which, you know, basically helps you see that that's a significant factor. Our MSU cases, related cases by date of onset, look like this. We have had days 119, 110, 104 cases in a day, which is probably more than we've seen in the entirety of this pandemic on any given day. When we look at the percent positivity, I'm going to smooth this out for you in a graph for MSU, but you can see that our Ingham County percent positivity is kind of bouncing up here. This is not a 7-day rolling average. And you can see that the MSU percent positivity, we had to drop out a couple of numbers here, which is why this jumps around. Throwing a rolling average on it, which I'm going to show you later, helps with that a lot. But I think it would be helpful for you to see those two graphs on one slide rather than in two different places. So working on that. So the 7-day rolling average of incidence for the MSU cases, MSU related cases, looks like this, with their percent positivity here, and again trending downwards, but still over 10%. We were up at 22% for positivity with our MSU cases, MSU related cases during this period of time. New cases by week. There are not numbers on here, so I just got these graphs. Like, that was one of the other reasons I was late. I was tossing them down into here just as I was getting ready because they just came to me. So you can see that over 600 occurred in the week of September 14, 360 or 70 or so in the week of April 7th, and excuse me, September 7th. And then slightly below 250 at this point in time for the week of September 21st. But again, we will see increases in those counts as we get this dates of onset relative to these cases. Rolling incidence and disease. I think I already showed you this graph. So there we go. I think we might be at the very end of this. I'm going to stop share. I'm going to get myself back on camera here by opening up. I just returned my devices here. So there you go. I'm here. And that is, did I stop sharing?
Yes.
Yes. Okay. So we're good.
Oh, you're sharing again now, it seems.
It does seem. Okay. It does seem.
All right. Very good. With our first question, we have Kyle Kaminsky. Go ahead, Kyle.
Hey, Linda, I was just wondering if you knew offhand how many cases we had countywide on September 1st. If you don't have specifically, I'll take a ballpark.
Hang on just a minute. Cases in the county on September 1st. I can get you that number. Date of onset. Just give me a second. Oh, I can tell you the total number we had that day. You're wanting to know how many cases were in the county total as of that day, aren't you?
Yeah, that's right. How many on that day?
Yeah, I'd have to go back and look, unfortunately. I'll get you that number later. I can tell you that at this point in time, we're looking at roughly 45% of our cases have occurred since the 1st of September. So that is a number I do know, but I can get you that number. It's just not on the graph that I'm looking at right now. So sorry about that.
I have the case count on September 1st as 1,750.
Thank you.
So there's a slight difference between the case count and the onset.
But that's a total case count as of September 1st, which I think is what you were asking, Kyle, relative to our total case count today, which is 3,230.
Yep, that covers it. Thank you.
Mm-hmm.
All right, Chris Lewis, go ahead.
Hi, Linda. Just a question about schools. A lot of school districts are trying to look at what's next for them, and I'm sure that they've been reaching out. What kind of guidance are you giving them in regards to where we're at right now as they're looking forward?
You know, there are some metrics and guidance for the schools relative to making those decisions. And I actually have a meeting with all of the Ingham County superintendents right now. You know, we do have to consider that right now we're looking at a very different situation in East Lansing than, for example, in Mason. So rather than the entire county, which was what we were able to look at before, because, you know, things were fairly well dispersed, we have a situation right now where, you know, East Lansing might be something that we need to give a different consideration. All right.
Thank you.
Kate Wells, go ahead, please.
Yeah, hey Linda, can you guys hear me okay? I'm sorry, my internet is coming in and out here. So I apologize if this sounds a little unstable.
Yep.
Linda, I'm wondering if you guys can define, okay, good. I'm wondering if you guys can define what you consider MSU related, and is there a total number of MSU related cases so far? I'm struck by how much higher these numbers of MSU related cases are than what the school puts as just sort of its student and employees at about 548 cases, and then even larger than what MDHHS released yesterday in terms of both community and students at about 500 as well. Can you just speak to that a little bit?
I can, and I am, you know, working with the university on that. We're looking at about more like 1,200, 1,280. I have to see the exact number. I might be able to find it real quick. I'll just get back to it later. It's definitely well over 1,200 cases. The university is using basically cases that get reported to them by students, as well as cases that are tested within their clinics. Though their dashboard does also say that they are using cases that are basically coming to them via notification of the local health department. So right now I'm, you know, really working with them on the fact that we know these numbers. MSU related is an MSU student, an MSU faculty, and MSU staff. Okay. When I give you those counts, we are not counting some of the MSU secondary cases as MSU related. We tell you those as secondary. So when we find the 40, 50-year-old parents, or the 67-year-old grandparents, or the 11-year-old brother or sister or nephew or whatever, those are not being reported in this right now. So they're
Gotcha. You don't include those as MSU related.
Those exposures were due to a direct contact of a household member. They were not due to exposure on campus. Kind of a little atypical in reporting secondary cases in that, say, roommates of individuals who become ill, that typically can be defined as a secondary case, but we are putting those in the MSU related case because honestly, with as many cases as going on, it's often difficult to tell whether that exposure truly was from that roommate or from others. Clearly, you know, when you have multiple roommates in a house, some of them may got exposed to somebody else all at the same time. So the MSU secondary cases that clearly fall out of, you know, student, staff, or faculty are not listed in these MSU related cases.
Gotcha. Okay, thank you so much. That's really helpful.
Mm-hmm.
Craig Lyons, go ahead, please.
Yeah, Linda, looking at as the cases of MSU tide continue to rise, what do you see as some of the next steps to help contain the spread? I know the voluntary self-isolation of the MSU community is supposed to lift next week, and you know, even some of the quarantine houses, those too are going to be coming due sooner than later. So what do you see as the next steps to help contain this?
Well, as I have said, I'm kind of feeling like I'm running out of tools in my toolbox. So, but you know what? I'll find some more. So there are, I mean, you see the measures that have been taken, none of which are off the table. Grand Valley State University did a shelter in place order for the entire GVSU student population that was there in, I believe, Allendale. They are a very different university than we are, in the sense that we have 2 medical schools, nursing school, law school, some other things, many, many graduate programs, which brings to us many, many, students that are in a completely different age group, are married, have, and so a shelter-in-place order across the board impacts them as well. So that becomes a little bit more challenging, but not off the table. Looking at those gathering size requirements, certainly, evaluating whether those gathering size requirements need to be adjusted, or maybe we just do not allow, indoor gatherings, or, those sorts of things. The other option is to start looking at some of these larger apartment complexes where there are numerous cases, in some certain places in apartment complexes. I will tell you that those people have been identified by our staff already and have been told to quarantine. They're not under a mandatory quarantine. They are a mandatory quarantine in the sense that they've been told to quarantine. It's just not via an order from me. So that is an individual thing, an individual follow-up. But as we see cases to start to increase in areas like that, there are always those options as well. So there are kind of a number of things, and I'm open to ideas, and that's kind of where I am right now. I will say I'm concerned. As you see from the MSU graph, it looks like, things reached a peak and are quickly dropping down. I do know from comments from some of the people involved in these quarantines, some of the people that are closely connected to them, et cetera, that it appears that there may be choices going on right now just to not get tested in order for an isolation and quarantine not to be imposed. So that is a deep concern. I understand that in general, they feel that this is punitive. This is not punitive. This is protection. It's protection for them. It's protection from their other students that they engage with, their roommates, and it's protection of the broader community. And so how to get that message through and understand that this is not about being punitive. These quarantines were needed anyway. Each of you in a house that has cases would need to quarantine, and it wasn't happening, and we had to take action. So that is one of my concerns right now, is I do see testing just starting to drop off in the MSU community in general. And my concern is that they may be choosing not to get tested to avoid a lot of these things.
Yeah, and just as a kind of a follow-up to that, what would you say, what more from the university's perspective do you think they could be doing, working with the student population and faculty and staff to help with the containment measures?
Well, they are certainly helping us with identifying, students and houses and, those sorts of things in order to help us with these quarantines. They do have a student process. They have a compact that basically requires them to collaborate with public health, including contact tracing. And so to the degree that they're not, that is basically a consequence to them from the university. So those things are in process in some cases, clearly, again, punitive, but at the same time, they agreed to a compact when they came back that is what they would do. And when they don't do that, then the university holds them accountable to that student code of conduct. So those are some of the things that the university is doing. Certainly, there's always the option of more broad scale testing. Testing every day is a challenge. A testing result is good for that moment in time. And so enhanced testing is just a double-edged sword in some ways. So have meetings with the university on a regular basis, coming up with, what are the other things we can and should be doing. Don't have a lot of answers right now. This has all come on us in, a week, 10 days? So.
Next, we have Kyle. Kyle Kaminsky, go ahead.
Follow up, that drop off in testing at MSU, can you quantify that at all? I mean, what kind of, what are we seeing in terms of fewer tests over there?
I can't, it's more anecdotal. I do see testing numbers dropping off. But, it's entirely possible because, we've had other cases, testing numbers drop off as people, get identified, quarantine, and isolate. So that's always a possibility. But I have heard that there is a disincentive to test given the consequences of quarantine and isolation measures. And that at that point, it's just a little bit anecdotal. And it's hard to trace that back to, these specific testing metrics. So, I have anecdotal information.
Wouldn't we be able to just see very clearly that there's a drop in daily case processing? Or, I mean, am I oversimplifying it here?
Yes, because the drop in daily case numbers is truly a drop in daily case numbers. There is a drop in testing that I've seen along with that. That could be because there are just less people becoming ill and they're not getting tested, or less people being in contact and they're not getting tested. Or it could be from this, anecdotal information that we're kind of hearing, this rumbling that basically some of them are just not getting tested. So,
thank you.
Next, we have Brittany Flowers, followed by Chad Levengood.
Hi, Linda. This is Brittany. I have a question for you about Halloween. I know the CDC yesterday basically announced that they highly advise against Halloween, trick-or-treating, things like that. Do you have any concerns that people in the county will still try to, I guess, make trick-or-treating a thing? And does that come down to a decision from the health department, whether or not that's something, that there's a countywide ban on?
At this point in time, that both the mayors of East Lansing and Lansing have asked me that question. It's like, what are we gonna do about Halloween? As you can see in the SAFE guide, the guidelines, it's like they don't even recommend the trunk or treating kinds of things. They have a number of different things where it's like you go on a treasure hunt and you just look at the Halloween decorations as the safest, and they kind of build up from there. I think it's going to be a community by community decision. I think that it is going to take us, things change so rapidly. We could continue this downward trend and be in a very different place, or we could continue to have a spike and have more concerns. But within the next few weeks, unfortunately for me right now, it's like really hard to see where things might go even more than a week at a time. With the way numbers are going. So I really, am kind of on pause until sometime in, earlier October to really be, engaging with those mayors and talking about Halloween. I believe the mayors would essentially, cancel Halloween in their communities and look for some alternative kinds of things relative to that, whether or not we need to just basically issue a guidance or a recommendation that says that we strongly discourage it. That could happen. I don't see an order happening that mandates that people don't trigger. I just don't see that. If that's what you're asking, that's not going to happen.
Do you have a message to people who might say, regardless of the numbers, they're still going to have trick-or-treating for the sake of continuing the holiday tradition? Do you have a message to those people?
There are CDC guidelines out there that talk about the relative risk of that in some cases. We do have right now, remarkable increases in cases in the age group of 10 to 19, as well as the 20 to 29s, who are probably less likely to be trick-or-treating. We do have certainly, communities. The East Lansing community right now is, you saw the big yellow spot. So I think we have to take all of those things into account, which means I just gave you a long answer that didn't answer your question, and I hate to do that, but it is something that we are going to have to look at and make some sort of a decision and put out some advice on, as we move on. When we put out the advice, and if the mayors in the various places, whether it be Lansing, East Lansing, Mason, wherever, say, we're not doing trick or treating, then, that's pretty much the recommendation. And what happens at that point, I don't know. I don't know, have we had to cancel trick or treating before? Seems like we have for some reason or another. I can't remember what it was, but.
Thank you.
Mm-hmm.
Next, we have Chad Livingood. Correct me if I've mispronounced your last name. Oh, you're muted, Chad.
Live and good. Yeah, Linda, when you said that you feel like you're running out of tools in your toolbox, is there some tools that the legislature or governor via executive order could give you to make so you could do more sort of on the ground management of this?
Some of the tools they can give us is increased testing, which is actually fairly robust here anyway. I mean, Sparrow has been one of the leaders in testing in the state. Increased help with basically contact tracing, which they are doing for us. We're doing some pop-up testing, neighborhood testing sites, those sorts of things. Beyond that, with regard to the situation that we're dealing with here right now, it's really more of there's because it's not a statewide thing, you wouldn't expect a state issue. And generally the state does not come in and say, okay, other than putting us in phases, Ingham County, you will not do this. The local health code has a lot of broad and independent authority for local health officers to make these decisions. And unfortunately, when we're dealing with a situation in a locality, Ingham County right now, and particularly East Lansing, those are really things that we need to evaluate and determine within the public health code and the authority in the public health code, what other things we can do. You did see Grand Valley State University do a shelter in place order. We talked about that already. There are a number of things like that is like, how do we get these things kind of in control. The Interfraternity Council at Michigan State University voted not to put a moratorium on social gatherings. The University of Michigan Interfraternity Council voted to put a moratorium on social gatherings. I think there's entirely possible that kind of signals the rest of the university about partying and where we stand with partyings and social gatherings. And I believe the Interfraternity Council is in the process of retaking that vote. And I certainly hope that it is a vote that puts a moratorium on social gatherings until we can get to a place where, social gatherings are safe.
Would you like to see MSU require students at some level, grade level, get mandatory testing? Maybe upperclassmen only?
I think, right now with what I feel is the challenge that we're dealing with, which is, some of the houses and other places that we put under quarantine. And again, this is anecdotal. It is directly from some sources. However, I don't have a way to just verify it. They're hearing it and reporting it to me, that, if a house has a case, to get the rest of the people in that house to actually get tested rather than avoid it so that they don't have to be isolation and quarantine could help. Whether they can mandate that or not, I don't know. Mandatory testing kind of across the board where it's not in an area where we know close contacts and, spread of the illness is happening. Again, the challenge always has been with mandatory testing is like, you can mandate it today. A whole bunch of people can test negative today and be sick tomorrow. And so the test that and then that creates that false sense of security of, I just tested negative yesterday, I'm good to go. If you've been exposed and your body is incubating the virus, it takes a while for that test to be able to detect that virus replicon and say, yes, you are positive. And that literally, from a scientific perspective, happens at a moment in time. If I tested you at this moment, you'd have tested negative. If I tested you at this moment, you'd have tested positive. So there are advantages to mandatory testing, but it's not a kind of perfect answer in the sense that it is that moment in time answer. And what signal does that give to students in terms of, I tested negative, moving on? Where if you've been exposed, and I've told you you've been exposed and you should be under quarantine, you don't test out of quarantine. And right now, the larger community should be under quarantine, and testing, if they could quarantine, testing wouldn't be as critical. So it's a really challenging situation with the testing. Testing definitely needs to be broadly available. And then it's just a matter of how frequently you can test within a system if you're going to mandate testing and mandate it regularly. Does that make sense?
Yeah.
Okay.
Next, we have Rachel Sweet, please.
So, continuing on the topic of MSU, so we are hearing that some students say that, or people at MSU are having a hard time doing contact tracing because some students are not wanting to rat out their friends. Have you heard about this? How are you guys handling this when people don't want to, quote unquote, rat out their friends?
So yes, we are hearing that a lot. Nope, I won't give you that information. No, I won't tell you that. No, I won't tell you. I mean, they might have a non-local address, but they do live locally and they will refuse to give us that address. Any number of things, including just hanging up on us. So unfortunately, that presents a lot of problems because, as we know, and we've heard this since the beginning, testing, large availability of testing, followed by contact tracing, followed by isolation and quarantine is the way to contain the spread of this virus. So when we can't do that, we have no way to contain this. So, the rest of the answer is that unfortunately, it is part of the public health code that they have to comply. So they do receive a warning letter from us that says, per this law, you have to give us this information. Here's a warning. The other thing is because the university compact was written the way it was and the university is working with that, we can refer the information we need to refer to the university, which clearly does not include clinical information or anything like that, but just, the information required that basically talks about the refusal to disclose information, the refusal to give contact information, the refusal to tell you what party they went to, where, those kinds of things. So that's kind of where we are with that.
Okay, and then adding to that, with the Big Ten and football players, how accurate do you think the rapid testing is when they have to go and get that done?
It's actually fairly rapid. They've developed a test that has some pretty good specificity and sensitivity. So there's a specificity and sensitivity end on testing. One has to do with false positives and the other one has to do with false negatives. So those are the two things that you want to pay attention to. They do have a fairly high sensitivity and specificity. So I do think that in general, the Big Ten has put together a really good plan for the athletes and for what's going on in the stadium. The university has said that there will be no tailgating and parties on campus, and clearly they will have to enforce that. You saw the heat map. We have a community sitting right outside of all of that we are deeply concerned about what's going to happen when football starts and gatherings and large screen TVs and parties here, and we're going to just start this whole, kind of party thing again, and then what will happen. So right now, my hope is that they've given us until October 24th. I did not come out and just flat out make a statement saying that I didn't agree with it. I do have my concerns with it. My colleague at the University of Wisconsin, Dane County, did come out with a statement basically saying that she did not agree with and did not support the decision of the Big Ten. given that we are not looking at games until October, and I'm always eternally optimistic that, you know, that trend is going down, and by next week, maybe things will be better instead of worse. I give myself until, you know, closer to the time when the Big Ten would start, and then I will not be hesitant if our numbers are still, you know, in levels that I'm incredibly uncomfortable with letting the university know that that's not something that I can support at this point in time. I do believe, I didn't see it at the beginning, there were some metrics in the Big Ten plan that talked about they will test all of their athletes every day, and if they start getting percent positivities, there are triggers to discontinue games or whatever. I didn't see a community level indicator in there, but I'm hearing that there is. And so I need to dig that up, because what I would like to see in the Big Ten, and the Big Ten folks did say that they were going to send it to me, is something in there that takes into account what is going on in the community immediately outside that stadium, because people are going to come into town. People are going to have those tailgate parties now, since they can't happen on campus other places. There are going to be parties in a variety of places. There are going to be people gathering at bars and restaurants at big screen TVs. That's not my major concern right now, because our bars and restaurants have done a phenomenal job after the newest executive order came out, which, you know, you can be at your table, you can't congregate in dance floors and other settings, you can't get service at the bar, table 6 feet away, and they are enforcing that. So, you know, to the extent that they can continue enforcing that, that's not my biggest concern. It would be, you know, the parties that are in the gatherings, I shouldn't call them our parties and gatherings and watch parties that will be going on. And, you know, what numbers of people are attending those. It shouldn't be any more than 10.
See what happens, right?
Yeah. So definitely closely watching metrics leading up to that period of time, and probably giving them an assessment of where I think things stand right now within the county at large, within the East Lansing community, as we see, because they are right now kind of their own, you know, community within this community in terms of what's going on with cases. And if we need to advise them that this is not a good move right now, then we will. Whether they take that advice or not is another thing.
Thank you. I have one more question, but I will wait to see if anybody else has anything else.
Okay.
We have Dave Ackerley next.
Hi, Linda. Okay, following up on that, if today, knowing what you know with East Lansing over the last 3 weeks, if kickoff was today, would you tell them to go ahead, or would you tell them to call it off?
I would absolutely tell them to call it off.
All right. Have you had any reports of any issues with high school football that kicked off late last week tied to cases?
No, I have not. And for some reason, I think maybe it's because I'm the Ingham County Health Officer and it's Lansing, and it's like, you know, all the state associations are here. This morning I was advising the SCAO and the Supreme Court. I am going to be on a call with the Dr. Michael Shingles, who is the you know, physician, the physician for the MSU football team, who does a lot of advising and counseling and working with the different athletic trainers throughout the different high schools. He's been asking me a lot of questions and trying to kind of get, it's like, okay. Right. And finally I just said, you know what, you want to come here onto your Zoom tomorrow morning, I will help you. So I'm going to be talking to all of them tomorrow.
Okay, last question. Referring to Sparrow Hospital, I had on the air their director of labs, and he said they're going to shortly be able to ramp up with a new platform for testing and an app. They've been doing a ton, but they can go up to like 6,000 a day. Do you see any point where we will need that in the area? If we get to the point where 6,000 are being tested a day, what would that tell you as county health officer?
Well, I think that we wanted to get at a point where we were testing at least 10% of our population. And that was a minimum bar. was the capacity to do that. And let's keep in mind that Sparrow tests in Ingham County, Clinton County, Eaton County, Livingston County, and sometimes other places in the state. You know, there's satellite facilities. You know, you got Sparrow in Sparrow Clinton, Sparrow, my son used to run cross country meets there, and at Carson City, those kinds of things. So a lot of that Sparrow laboratory testing is coming into Sparrow laboratory for some of these other areas. So that 6,000 capacity is not just for us.
Okay, next we're going to go back to Rachel Sweet and then to Brittany Flowers.
All right, thank you. This is one from a newsroom. It's a little weird. What do you think? In Ann Arbor, they just voted to decriminalize psychedelic mushrooms. So what do you think of that, or what do you think are the health risks of that?
Wow, that's a curveball.
I know, right?
You do know I have to research things for just a few moments.
You could come back to it later.
You know, I've got such a scientific background. It doesn't take long to research some things and have a good sound opinion on that. But I kind of need a little heads up. You know, I have heard some concerns about that. I haven't seen that trend here. I did hear about somebody recently that got into a little bit of a mushroom situation that got, you know, a little bit intense for them. So the question particularly is they are putting, they've issued something about the dangers of those in Ann Arbor, University of Michigan, yes?
Mm-hmm. So they're decriminalizing it.
Ah, they're decriminalizing it.
Yeah, they voted to decriminalize it last night, and then we had someone in the newsroom just say, what are the health risks to it?
That is an excellent question, because you decriminalize mushrooms, and just like we did decriminalize marijuana. And at the point that we decriminalize marijuana, there are also a lot of safety guards, QC, making sure that what's in it, you know, it's like it's got this much, you know, certain amounts of THC, that sort of thing in it. And so what's in place when you decriminalize to make sure that things are, you know, some sort of, you know, level of, you know, are you getting a dose of that is, you know, relatively safe versus whatever. You know, that is basically more of an Ann Arbor ordinance. That's something that wouldn't come from the health department, although the health department might come out and say, I don't think that's a good idea. I haven't really given a lot of thought to mushrooms.
That's okay. I was sent the question, so I thought I'd ask. So thank you.
Go ahead, Brittany Flowers, please.
Okay, Linda, I just want to make sure that I am understanding correctly on the topic of MSU students and testing. So the reports that you're hearing, I know you said they're kind of anecdotal, but so these students are essentially, are they saying we're being quarantined, we're being punished, so we are not going to get tested? I just want to make sure that I understand that.
I've heard some student comments that are basically like, you do know that these things are disincentivizing us from getting tested. And I have heard from other people within the system that, well, they're just not getting tested. You know, they don't, you know, so again, you know, that's anecdotal. I did see a few comments directly from some of them that really pretty much said, didn't say that they weren't getting tested, but it says you're disincentivizing from getting tested. My response to that is you can not get tested, but transmission in this community will then go unchecked. No ability to contact trace, isolation, quarantine, deal with it at all. You think you're just going to manage it on your own. You feel sick for a few days, I'll stay in, whatever. You were contagious 2 days before. We've got all those things to deal with. That could very well result in increased transmission in the community because we don't know. And then whether you get tested or not, it's entirely possible that escalating numbers in the community could result in actions. And I hate to even say it because it boggles my mind to do it, things like what they did at GVSU. Again, I believe our student population is very different with the number of graduate students, graduate schools, professional colleges, law school, medical schools, nursing schools, veterinary schools, that is a bit more complicated issue in East Lansing than it is at Grand Valley and in Allendale. So it's going to take how do we dissect this apart and do it in a way that gets to and is supported by the data, because I can't just write an order that's not supported by the data. So, what are our options when it comes to that? But not testing doesn't keep it from not happening. Not testing does not keep us from not having cases. Not testing, in fact, doesn't identify cases, doesn't allow us to contact trace, doesn't allow us to get you in isolation and get your contacts in quarantine, and basically sets a trend forward of just basically completely unchecked transmission. And whether they in particular get tested or not, when we see the increase in numbers broadly across the community, that will kind of point back to that, and then we have a community that we have to deal with.
Thank you for responding to that.
Okay, that gets us through all of our questions in the queue. Last call for questions. Oh, Robin Erb, go ahead.
I'm sorry, I'm asking you to probably repeat yourself, Linda. I was having internet trouble at the beginning of this too. I'm still confused at the 1,200 number. And again, I'm probably asking you to repeat yourself, but MSU has such a different number that they're reporting, and I'm not understanding the difference. I hear what you say. You define it as faculty, staff, or students.
Yeah, as do they.
So why are the numbers so different?
Because right now, my understanding is that if you read their testing report site, what they say is that we are looking at cases that are reported to us directly by students or are tested in our clinics. And then there is a section that says or reported to us by other clinics or the local health departments, which I am reporting those numbers to them. There's been some confusion about, well, you've got those numbers, but we don't have any way to verify that they are students. Well, but they're telling me they're students. Their addresses are student addresses. They, it's like I'm verifying in some cases that they are students. So continuing to go about this way could be a bit problematic when our numbers are so very, very different from yours. And then, we're just going to have to resolve that issue and understand, how are we going to resolve this issue since your numbers are so very different from mine? And the bottom line is that that's, unfortunately, perhaps going to reflect more poorly on you than it would us. I don't know. These are the numbers that I have, and I have no way to change them. These are people who have had contact tracers in talk to them on the phone, investigate them, have them say that, basically we are MSU students or an MSU staff member or an MSU faculty. And then those are the numbers that I have. In some cases, I have taken, because some fields are missing and those sorts of things, I have checked with the university to make sure that students are students. So right now I'm sitting at 1,250 since August 24th. Those are the numbers that I have. I think the MSU dashboard goes back to maybe the 9th or the 17th. I think I did have a graph in my PowerPoint presentation that showed you theirs, but it didn't give you numbers and it didn't give you that total. So beginning 8/24, it's 1,250. By the way, most of those since September 1, which kind of answers your question a little bit, Kyle. in that 8/24 to 8/30, those were just 41 cases. So basically 1,209 of them have happened since August 31st.
So and I don't know how this works. When you report, let's say it's a Robin Erb who's tested positive, do you report Robin Erb to the university?
I do not.
So how do you report raw numbers? I mean, how would the university know then? I guess I'm trying to figure out the transfer of information.
And that I think is that is, I think is where the university is a little confused right now. We are the public health system. We do contact tracing, we do investigations. We are talking to students on the phone that say, I'm an MSU student, I'm an MSU student, I'm an MSU student. We mark that as an MSU student because they told us that. And if they don't tell us that, then we're not counting them as MSU students. The ones that we perhaps don't have that information, we've been able to look at some various demographics about age ranges and addresses and things like that and get some verification from the university that they are indeed students. But I feel very confident in these numbers.
Thanks, that does help clarify it. Thank you very much.
Okay, last call for questions. All right, hearing and seeing none, that will conclude our media briefing for Tuesday, September 22nd. Our next meeting will be Tuesday, September 29th at 3:30 p.m. I'll send you an invite 1 to 2 hours prior. Thank you everyone for joining us today. Have a good day.
And I'll work out my technical glitches before we get back. They returned my Surface Pro to me yesterday, and all this time, I mean, I know you don't want to hear this, but I've been working here for 6 months. I got spreadsheets over here, MDSS over here, trying to do it. And I finally was just like, I gotta bring my double monitors back because this is nightmarish. So
can I ask you one last thing?
This morning
I still have you on the phone.
Having technical difficulties. So
can I just ask you to clarify that one last thing, Linda?
Sure.
So, I mean, I'm going to be blunt. It just sounds, I mean, the public health department, I'm trying to make sense of this in my mind. You have all the information of every positive case, right?
We most definitely do. Every single one of them.
I mean, this is where I get really blunt. This just sounds like the university isn't trusting the public health department with your contact tracing to say these are the MSU related cases. I'm trying to make sense of it. It just doesn't.
Well, I am working with them right now about that very fact. It's our numbers are very different, and on their website they say the numbers reflect only, right? So they're saying we don't know. The numbers reflect only those that have been tested and self-reported to the university, or those the university becomes aware of through campus testing sites or local health departments. I'm like, you either need to take off the fact that you're getting that information from local health departments, or you have to take my numbers.
Yeah, that makes a lot of sense.
So there is some concern that they don't know whether my numbers duplicate with theirs. It's like, well, then maybe you just need to replace your numbers with my numbers, because I probably have a far more accurate count than you do when I'm looking at you at 548 today, and I'm looking at more like, 1,280.
We've been trying, I mean, there's a number of the reporters. I mean, we've been trying to get at these numbers, and it's just not MSU. It's colleges, it's K-12 schools around the state, and it's really hard to sort through it. And we're reporters. I don't have kids right now at these schools.
Right.
I'm thinking, how are parents supposed to sort this out?
I don't know. I do think, we are the local health jurisdiction in which Ingham County or MSU resides. If any source of information has the most accurate count of MSU related cases, it's us.
No. Well, thank you for taking the extra time.
Yeah.
I think Kate had a question too, kind of along those same lines.
Yeah, thanks. Well, it's because I've been texting Robin here in the background of being like, what? How is this so wildly different? and Linda, I don't want to harp on it, but so I guess and I've asked MSU about this, so maybe they'll give us more explanation. Is the duplication something that they're worried about, where they say, unless you give us names, we can't make sure that we don't have duplicates? And is there a reason you can't provide names to them?
No, I can't just blanketly provide names to them to just verify. We've got HIPAA issues going on here. I can provide names to them if I am having a challenge finding a student, no phone number, no address, no nothing like that, and they need to do that. That's a public health protection activity. I can work with them with names, of people who are violating quarantine orders and things like that. That is a public health protection activity. I can work with them with names and things like that with people who refuse to comply with the contact tracing and those sorts of things. I can't just blanketly send them a whole bunch of, known positive tests that I have and disclose all that information. The information needs to be disclosed to them to the extent that is required to protect the public health. It is not to be disclosed to them just so that we can compare our numbers. So yes, there might be duplicates. My suggestion was then maybe you should just take our numbers because ours are probably more accurate. There was a comment about, but we can't verify that they're students. It's like, I'm telling you that they're students because when my case investigators talk to them, they tell us. And quite honestly, if you look at the age range and the addresses, it's like it's the right age range and it's the typical student housing places. And so, all things point to that. I'm not making up numbers. I'm not throwing in extra numbers that just kind of look like they might be an MSU student without knowing. We are being told that information by the individual themselves, just like they're getting somebody say, I called you up and we reported to you that I'm positive. They are reporting to us after we find that they're positive, that they're MSU students. It's the same thing, it's just a little backwards. I think they were struggling with, they wanted to verify in order to make sure that the information we gave to them really was their students. But again, we are, working with case investigators at the state, our own case investigators, to basically make sure that when that conversation happens, we find out that information, it gets documented, et cetera, et cetera. So those case counts, I'm very confident in my case counts.
Who are you talking to at the university? I mean, is it their health people? Is it their IT people? Is it their leadership?
Basically a couple of different people just to kind of sort this out. And it's not that they're unwilling. I think we're just trying to figure out how do we blend these things together? Because, we work very well together. They are amazing. They have been amazing partners. I mean, I will tell you that. Everybody from, their public information people to their government relations people, to their community relations people, to their fraternity and sorority relations people, to, Dr. Beauchamp, Dr. Weissmantel, I can't even, describe to you the MSU people that have been working with us and have been phenomenal partners. So this is by no means a grander criticism of the university, but as we saw these numbers start to become very, very disparate, my question or my point to them is, if this continues, because I'm going to go on to news briefings like this one today, and I'm going to disclose the numbers that I know, and they're going to look very different from yours, and it is going to call into question what's going on at the university. So we need to work this out so that doesn't happen. I'm trying to help them. We need to work this out so that doesn't happen to you. So how do we do that? No, I can't send you 1,280 student names and ask you to spend, I don't know how much, time, putting them through your system and verifying that they're students or not, or MSU related in terms of faculty or staff. Basically the MSU students who basically might expose a younger sibling or a parent or something like that, we're not counting those numbers. Those MSU secondaries are not part of these MSU related cases. That's secondary to that. It is not an MSU student, faculty, or staff member that makes it an MSU related case. I spent probably way more time than I should have going through data myself, trying to clean it up and make sure that it was as accurate as possible. Literally Friday, Saturday, Sunday, all day and all night.
Here's my big question. When was the last time you had a day when you didn't think about COVID? No.
Maybe in January sometime.
Right. Well, this has been really helpful. I'm good. So thank you very much for all the clarification.
Linda, and I'm hoping though that you can, sorry, my partner is putting dishes away in the background. I guess what I am just struck by is, again, that 1250 number, since that is sort of the first time that we're seeing a number of that size. It just boggles my mind because that would make MSU by far the campus with the most cases by just an exponential amount. I think Grand Valley has 872, including community members.
Oh, we aren't including community members in ours.
Right, that's what I mean. To what do you attribute that? What is MSU doing wrong?
Oh, I don't think it's wrong. I think it's like, here's a good idea, here's how we'll do this. And then as we saw these numbers grow, I mean, early on it worked out okay, but as we saw these numbers grow, we became increasingly very, very different from each other.
No, I mean, like, what is MSU as a community doing wrong to get such a high, I mean, Central Michigan is so far below this. It just seems and I know you've been saying this in your press releases of like, hey guys, we are the highest risk place in the state right now. Like, we are way above the threshold for high risk, but this just boggles my mind that it would be of this size compared to other schools.
Yeah. Yeah, I agree. That's why we're deeply concerned. You know, and as you know, I mean, you know, right now it's the students, then there are the secondary infections, the infections after the secondary infections, and eventually we are, you know, I will just say once again, then it becomes our people of color, our elderly people who are more at risk, as well as our people with underlying health conditions who are more at risk. And while students in general statistically have less severe illness and less complications and those sorts of things, that doesn't mean they can't. But my concern is now what's going to happen in the surrounding community with regard to, you know, a jump or two. You know, it may not be that next person, because that next person may be a family member or another student, but eventually it is, you know, you go to work and, you know, it's your boss, and then it's your boss, and there, you know, it's like eventually, you know, it starts to basically be a broader community transmission, which then puts more people at risk beyond the, let's call them 17 to 24-year-olds that are currently being impacted in the East Lansing area. And let me make no mistake, we are deeply concerned about them and their health as well.
Linda, I realize you don't have insight into every single college and university and everything that every university student is currently doing or not doing, but do you have any indicators at this point, any clues as to why this might be happening in the MSU community to such a degree? That's what I meant by when I was like, what are they doing wrong? That is either not being caught by testing in other places or just isn't happening in other places.
I have a few thoughts, some more controversial than others. So I might keep some of them to myself for right now. But I do think, and I do hope, that the decision of the Interfraternity Council will change. I do think that the decision to have no moratorium on social gatherings at at the interfraternity council level. You know, I don't know, it's been a long time since I've been in college, but does that signal the rest of the university that we do parties and they're having parties at the fraternity, so we're going to have parties too, you know? Or does a strong statement from the interfraternity council that this isn't safe yet, and even the fraternities are not going to have parties, kind of cause a little bit of a, you know, whoa, you know, maybe parties and gatherings are not the wisest idea right now. So I look forward to hopefully a vote from the Interfraternity Council that overturns that vote that voted no on those moratoriums on social gatherings, because I think it's important. I do know that that happened at U of M. And whether that is one of the significant difference between us and U of M is that moratorium on social gatherings with the Interfraternity Council, I don't know. I know that they are struggling with their university president and testing related issues. And then, you know, I think we have first of all, we have the largest student population in the state. This is the largest university in the state. They did come back. I think there's been some comments that it's like, did we let them know too late? And that's why they just came back anyway. These lease agreements were in place long before the 2-week notice that the university gave them. They would have come back anyway. Not only that, but we did have some students who would have been on-campus students kind of scramble to find off-campus housing when they couldn't move into the dormitories. So some of them came back as well. So we have a significant population in our area, despite not having the online learning, the in-face learning. And so how does that, it's like they're off campus, they're online learning, you know, what level of engagement and discipline and routine then is in place with them all here relative to going to classes when they are not consistently engaged and, you know, basically in some sort of routine and in some sort of a discipline about going to campuses and those sorts of things like that, if they had been back to face-to-face learning. And that's a tough decision too. I mean, when President Stanley made that decision, the University of North Carolina was all of a sudden experiencing significant challenges, I believe most of which have gotten under control. So, you know, that was a decision he made on the evidence that we had at the time. And it's you know, my science brain is going to continue analyzing this phenomenon. And honestly, all you can do is come up with hypothesis, because it's like, oh, had we brought them back, would it have been different? I don't have a control group to prove that. All I can say is, or had Interfraternity Council voted no on social gatherings, would that have been an impact? Would it have a greater impact in parties that were not even there? I don't know. But those are the things that I'm seeing that are differences, because we also know that U of M did go back to face-to-face learning. So there are a number of different things. I would by no means, I will tell you, would by no means criticize the decisions that have been made at that level, because we all make decisions right now. We're scientists, he's a scientist, I'm a scientist, we're public health officials. We make the best decisions we can at the moment in time that we have to make them. Are they always perfect? No, because we're not perfect people either. Do we sometimes have to go, let me walk that back because it really should be here instead of there? Yes, we do. And we hope people understand that that's the scientific process of learning, not us just not knowing what's going on and not knowing what we're doing. We learn and we change course because we learn.